So first, do you think there are any other questions that you think may be helpful to patients going through a transplant with regards to CMV?
Yeah, I have a couple of questions. So during COVID, how has the management of treatment changed for transplant patients?
Well, I mean, with regards to CMV, it's been difficult, obviously, with people, patients having to shield at home, and during the big surges, we've had to try to reduce the number of face-to-face interactions that we've done, and review more people remotely, either by telephone or video. But for people who had CMV syndrome or CMV disease, those were the ones who were prioritized for face-to-face interactions. Is balancing that risk between needing to see them face to face and needing to bring people to what would be considered a kind of a higher risk environment. And obviously, with regards to the pandemic, the reduced frequency of face-to-face interaction and the shielding that's been needed, for a lot of patients, that's been quite difficult with regards to their kind of mental health. And also kind of other factors such as weight gain or reduced physical activity, which those kind of issues are really important for the long-term well-being of transplant patients, beyond complications such as CMV, and I think managing those have been quite difficult during the pandemic with less face-to-face interactions, which fortunately now is back to being the mainstay of our clinic reviews.
Are there patients who have faced major problems with CMV? And if so, what are those problems or complications? And also, can CMV be fatal?
So CMV can be fatal, but fortunately that's now rather rare compared to a few decades ago, and that is mainly because of the increased awareness we have as transplant clinicians and the better methods of detection, prevention, and management. The majority of people after a transplant who get CMV may either be asymptomatic, or they may just have some mild symptoms of CMV syndrome, and often that's as much as they will get, and they will then get successfully treated. That's not to say that some patients may not get CMV disease, and sometimes in some cases that can be quite a major complication. So patients can sometimes get very severe CMV pneumonitis, for example, where the virus affects their lungs, and they may become quite unwell with that. So for some patients, very rarely, they will be hospitalized with CMV, and it is very rare to die from it, but we do see it because we do transplant thousands of patients every year. But fortunately, it's a lot rarer compared to what it used to be like a few decades ago.
What do you think are the most important things a patient should remember who has just had a transplant or is about to have a transplant regarding CMV?
So I think the most important thing to remember is that CMV is now easily detectable, it's preventable, and it's treatable. And whether what your risk of getting CMV depends on what the status of CMV is in yourself or your donor, that should not really influence your decision with regards to taking a kidney, because in pretty much most circumstances, a kidney transplant will be a better option than remain on dialysis. The most important thing is that even though immune suppression is probably the cause of complications such as CMV, the only way transplantation is successful is because of that immune suppression. And it's critical that our transplant patients take that immune suppression, and they take it as prescribed on a regular basis. And therefore, if there's any issues which mean they can't take their immune suppression, either because they've run out or they are vomiting and they're not able to keep it down, then those are the circumstances when you need to let your transplant team know. Because the most critical thing for us and our patients is to ensure that you are taking your immune suppression exactly as prescribed. The other important thing is to ensure that we have you on the right surveillance pattern after your transplant. You'll be seen very frequently for the first few months after your transplant, but then beyond that early period, the number of visits drops down quite significantly. But that's a very dynamic process, and it really just depends on how well you are and at what stage you are after your transplant. The important thing is that outside of those surveillance visits, if you feel unwell, you need to always have a little chat either with your local healthcare practitioners at your GP surgery, or contact the transplant team if you can, because when you are unwell, often it may just be something simple, a viral infection, cough or cold, but as a transplant patient, we should always be aware, have that differential, that could this be something else, and could this be something like CMV, and it's very important that you raise your concerns so that a responsible healthcare professional can look at that and either rule it out, or if you do have CMV, to pick it up early and treat it early. So from my perspective, this has been a really interesting discussion on CMV, and I'd really like to thank Fez for explaining his story and his experiences and being very open about those experiences. There are complications associated with transplantation. CMV is one of those, but there are many others. But we are very good at now picking up CMV and treating CMV. I recently just attended a conference where there were lots of sessions on CMV and looking at some of the further kind of advances in detection and prevention and management that are still being actively researched. And therefore, the purpose of this video is really just going to make you aware of the importance of CMV, but also to reassure you that it's no longer the fatal complication as it was before.